So before we understand, how to you inculcate a positive dental attitude so that the child does not have fear visiting a dentist, you must understand what is a subjective fear and an objective fear. Subjective fear is a child has been taken to a dentist or a physician and they had some very traumatic experience of pain. That will inculcate a negative attitude towards your dental health. And objective fear is majority of the time the child is an observer. They hear the conversation between the grandparents, between the parents, and if the grandparents had visited a dentist and had a very traumatic experience, and they will share among the family. So the child overhears everything, and their fear is indirectly transmitted to the child. So the major, so it is called as objective fear. That is because of the conversation between the elders, the fear has come to a child. Now, how can you avoid or instill a positive dental attitude depends upon the environment surrounding you. Like, you start early. When I say start early, you must start the routine oral hygiene for a child right from the birth. Like, take a gauze piece, rotate in your hand, wipe the gum pads, then introduce the brush, plain brush without paste early. So once you start early, the fear factor comes down. The second reason why the child has majority of the time fear is because majority of the time they have been to a doctor to get the vaccination done, and every vaccination is associated with an injection. So don't talk about negativity. Talk to the child about your positivity of why you should maintain your oral hygiene, why your regular dental visit is important. The third thing which I see the parents do very commonly, if the child is not brushing the teeth or having a lot of chocolates, they fear them. If you're going to do this, you're going to take you to the dentist, they're going to give you 4 injections in your mouth, or they're going to pull the teeth out. So the child is always in the okay. If you go to a dentist, they're going to pull the teeth out. If because that is used as a source of punishment if your child is not listening. Now, when you start doing that regularly, if you eat too many chocolates, you won't be taken to, the dentist is going to pull your teeth out. Then that kind of, sets in the child's mind, and they start avoiding dentistry. So start early. Don't use dentistry as a punishment or fear creating factor. Tell them the importance of good oral hygiene, why brushing is important, why eating and chewing your food important, because that clears away anything which is sticking onto the tooth. Give them the chocolates and sweets required, but give them in a limited portion. So when you start doing it, and if you had a traumatic experience because of your dental treatment, don't talk about it in front of the children's, saying that, if you do all this, you will also have a root canal procedure done. Then that fear is somewhere from the parent is transmitted to a child. So you start role playing things and you start educating them about the positive attitude, then the fear slowly weans off. And the second and another thing is, majority of the time you take a child to a dentist when they have pain. So it is wrong. You should start taking the child to a dentist as soon as the first permanent teeth come, or around the first birthday. That is what the American Association of Pediatric Dentistry, inculcates, that, you should start early.